Hi, I'm Jason Bellamy coming to you from CSM 2016, and I'm joined by Jay Irrgang. We're going to talk about the Physical Therapy Outcomes Registry. It was just a few days ago at the Component Leadership Meeting. Michael Brennan, who's the CEO of the Canadian Physiotherapy Association, was talking about the importance of data, and he cited the Physical Therapy Outcomes Registry that's in development as a potential game changer, not just nationally, but internationally. So you are the director of the new scientific advisory panel for the Physical Therapy Outcomes Registry. We're going to talk about that panel in a second. Okay. But the registry, the importance of it, give me a sense of that. How can this be a game changer for the profession, and how?
Absolutely, yes. Having access to data about what we're doing as we take care of our patients is critical. We believe that that data can really inform practice. It certainly can be used for quality initiatives, for payment initiatives, as well as for future clinical research to demonstrate what physical therapy does.
And so give me the scope of all the things the registry can do. I mean, how are you going to be integrated with other systems? How accessible will the information be?
Right.
Will it be for personal benchmarking or bigger benchmarking?
So all of the above. And basically what we hope to set up a system to do is that we will be migrating data in from electronic health records that provides information about the characteristics of the patients, about their diagnosis, their treatment, and their outcomes. And we would also like to have information about the therapist. So for example, their years of experience, their certifications, their fellowship and residency training. And by analyzing all of that data collected throughout the whole spectrum of physical therapy, it'll allow us to better describe what physical therapists do and the value of the care that they provide to their patients.
And the physical therapists themselves should know how they can better provide that value, right? But it also, to your point, allows you to articulate a case that physical therapy is as effective or more effective in certain cases, and really argue the value. Is that right?
Absolutely. What it's all about is value. You know, the environment is changing from reimbursement based on the volume of services to the value of services. And to be able to understand value, it's really the ratio of the quality of care, the improvement that the patient experiences relative to the services that were required to achieve those outcomes. And this system, the PTOR, will enable physical therapists to examine their own value of the care that they provide relative to other clinicians in their organization or relative to national benchmarks.
Right. So let's talk about that scientific advisory panel, 9-person panel. You're the director. Right. What's their role in the development of this registry?
So it's really to oversee the scientific integrity of the registry as a whole and to ensure that it meets the goals related to practice, quality improvement, payment, and research. So things that they'll be doing, for example, are to review and approve the variables that are included in the registry. They'll be making decisions on what outcome measures should be included, as well as the addition of other modules. So we envision a core set of data that's appropriate for all patients, but then we'll have specific modules that are appropriate for a deeper dive, looking at the effectiveness for certain patient populations. So for example, neck pain or knee pain or stroke or spinal cord injuries, so that we can provide a deeper description of the practice for those specific populations.
So you use the word envision in there, which highlights that obviously much is still in development.
Yep.
So here we are, it's February 2016, and I'm a physical therapist watching this, and I'm like, this sounds amazing. Like, how do I get involved? Right. How ready is this? What are the benchmarks coming up?
Yep.
How accessible is this to the average physical therapist? When will these things move along?
Yeah, so right now we are in a pilot testing phase where we have about 150 to 200 physical therapists voluntarily entering data into the registry. We've actually had some of those use the registry for PQRS reporting. Our goal in the coming year is to get to the point where we can electronically migrate data in from electronic health records, and the plan is to have a soft launch of the PTOR at the private practice section annual meeting and a full public launch at this meeting next year.
So we could be a year away from full public launch, and that will be a dispatch next year. You can learn more about the PT Outcomes Registry at ptoutcomes.com. For Jay Irrgang, I'm Jason Bellamy. You can catch other CSM dispatches at the CSM website, and I'll catch you later.